In recent years, the United States military has made progress in changing the culture of mental health, but stigma and lack of awareness continue to be deterrents for military service members to seek help. And here to fight against the stigma is retired Lieutenant Colonel, Associate Dean, and Program Director of Social Work over at University of Phoenix, Dr. Samantha Dutton. She's joined by the Senior Director for Veteran and Military Programs of Given Hour, Tessa Glenn. It's great having both of you ladies. Welcome.
Thank you.
Thank you.
Let's talk about the current state of mental health in the military. You know, there was a time where PTSD was like, dust yourself off. We've obviously come a long way since then. Where are we today?
Yes, we've come a long way since those days. The survey that the University of Phoenix conducted showed that we still have an issue, though, that 80% of military members are suffering from depression or anxiety or lack of sleep, and so those have long-term implications on their well-being. And of those, only about half of them will ever seek mental health treatment for that because they're afraid for their job and the repercussions of stepping forward and saying that they needed help.
Absolutely, being able to admit that they have an issue. They might feel like that's showing weakness, but that's not necessarily the case. They need to break the stigma for themselves.
That's absolutely correct. I mean, the survey results are pretty clear to show that we still have a long way to go to change the culture of mental health. We need to view emotional well-being in the same way that we view physical well-being. So if you break your leg, of course you're going to go to the doctor and seek care. Well, the same thing goes for emotional well-being. Talk about it, seek help. That way we can reduce those cultural barriers to counseling and we can help save lives.
No question about it. Now, how do we encourage them to do so? How can we help a veteran or a military, an active duty military member to actually go out and seek that help?
It comes down to conversation. In the survey, it was indicated that 75% of those military members would seek mental health counseling if someone that they knew and loved, their colleague, a friend, a family member, had shared their story of how they struggled with mental health and showed them a way out and gave them encouragement to go. And one of the ways that you can have that conversation and offer the help is to offer the Given Hour organization that offers free, confidential mental health treatment for their families and their loved ones to help them through that. But really it comes down to having the conversation and bringing the mental illness out of the darkness and into the light.
Absolutely, and that seems to be, I mean, even just having this segment right now to be able to just talk about the fact that it exists and it's okay that it exists and that we can do something about it.
Absolutely. Part of Given Hour has a campaign to change direction where we seek to educate everyone on the 5 signs of emotional suffering. So you can recognize it within yourself and recognize it in others, so you can encourage people to go and seek the care that they need. So number 1, personality change. Number 2, uncharacteristic anger, agitation, or anxiety. Number 3, withdrawal or isolation. Number 4, engaging in risky behavior or lack of self-care. And number 5, feelings where you're overwhelmed of hopelessness or feeling overwhelmed by circumstance. All of these are key indicators of emotional suffering. And when you're experiencing those or see somebody else experiencing those, engage with them. Often the best thing to do is just have a simple conversation and ask, how are you? Are you okay? And then point them to where they can seek help.
Those 3 words, how are you, can really help somebody in the course of their day. It's great having you. If we want to get more information, where do we go?
The best place to get more information on Given Hour and our campaign to change direction and to receive the free mental health care is giveanhour.org.
And if you want more information about the survey and exactly all the findings that were found there, you can go to phoenix.edu.
All right, ladies, it's great having you. Thank you so much for joining us.
Thank you.
Thank you.
For more on the support offered to our military, you can visit one of those websites on your screen, givenhour.org, phoenix.edu. University of Phoenix, proud sponsor of the Morning Blend.